Well, welcome, Suzanne.
Thank
I brought
you.
you on because I wanted to have you share a little bit about your dental implant experience. So, any notes to other patients thinking about getting a dental implant?
Sure. I would say, gosh, my experience here has really been so unexpected in that I was really, really nervous ahead of getting my implant. I have one implant. It's in the front, which is why I was particularly nervous, was how is it going to look? And I just have to say I am so grateful for the results, and the whole process was incredibly clear and informative and almost pain-free, so really just up and beyond what I expected.
That's great. Yeah, a lot of the planning beforehand is important when we plan for dental implants.
Yeah.
Any surprises about the process, I guess? Did you have any expectations beforehand?
Yeah, sure. I think there was a little bit after the implant of discomfort. And, how are you going to know how uncomfortable it's going to be or not? So, not that it was a tremendous surprise, but that it was there, and I thought, oh my goodness, right, okay, I have a new tooth in me, and it is going to take a bit of time for the mouth to heal, which is understandable, but I wasn't quite sure what that would be like, and I'm sure every patient is different. And
every site is different. I think a little bit about Suzanne's implant, we had planned beforehand, we take a 3D scan, and the 3D scan showed there was a deficient amount of bone on the front side, and I said, look, we're probably going to stage this in a few more steps than the average case in order to allow bone to grow around that void. And preparing ahead of time, I think, was helpful, so you knew how long you'd be. We never let any patient go without a tooth, so we always had a tooth replacement.
Yes.
And it wasn't a removable replacement. We had bonded a replacement in there for you,
Exactly. And I would say that was another question for me was, what was going to happen? Because, again, it is the front tooth, and what was in there temporarily was perfect too, right? You couldn't even tell it was a temporary tooth, so that was a bit of a surprise as well.
Yeah, that's one of the things I like to do for our patients is avoid removable temporaries, taking something in and out of the mouth. Sometimes we have to do that, but it's not the most pleasant thing for a patient to have to get used to wearing. Any questions you think other patients should ask their dentists before considering dental implants?
Sure. Obviously depends on the patient and any information that would help you through this process, any fears you might have. For me, it was really, I did not know what to expect, and it was timeline and process, and I have to say, you and Drew and your team were so helpful to me in getting back, because I had a lot of questions, and it was done in a timely way, and it was just done with a lot of care, knowing that this isn't an easy process for patients. So in your words, I would give it an A+, as you rate my cleanliness sometimes, or my flossing. I would just say that I have recommended this to many people, because I do have a lot of fears anyway going into sort of surgery kinds of health things. So this was great.
Well, thanks, Suzanne.
Yeah,
thanks so much
you.
for sharing.
Thank
and for
you.
any patients, if you have questions, as always, message us, and we're happy to answer any questions.